Joseph Eason, 3 children of course, soon to be aborted, at 3510 for the road. Forgive my prejudice for 3 minutes. So, ladies and gentlemen of the board, thank you for your time and letting me speak today. I'm a physician in the Birmingham community with children in the Mountain Brook school system. I originally planned to speak today against the mask mandate that was in place for Mountain Brook schools, although that has recently been adjusted to a mask option protocol. I agree. I still felt it necessary to come and address the board, however, as the new policy leaves the option to return to a mask mandated scenario likely. In the current healthcare climate, we strive to be data-driven and to practice evidence-based medicine. As you're making public health decisions for the school, I ask that you also be data-driven and use evidence for your decisions. Understand up front that regardless of the organization that you're trying to follow, CDC, ADPH, actual literature on the effectiveness of masks in COVID-19 is weak. Literature supporting mask mandates in school is weaker. Literature addressing mask utilization in children in any capacity is nearly non-existent, and long-term mask utilization in children has never been studied by any literature that I could find. So this evidence vacuum creates uncertainty in any decision that is made. When you find yourself in this situation, you must move back to what is known, try to do no harm, and then proceed from there. So what is known? COVID-19 has been deadly for adults. It has killed 4.9 million people globally and 744,000 in the US. But this virus, thankfully, does not pose the same risk to children the way it does to adults. 587 deaths occurred in the 0 to 18-year-old age group with COVID between January of last year and October of this year per the CDC website. And per the American Academy of Pediatrics, risk of hospitalization for children range from 0.1% to 1.9%. Mortality rates for children range from 0% to 0.03%. That's across 45 states. This virus is survived by children 99.9% of the time in the US. And furthermore, schools have not been proven to be a major source of transmission of COVID-19 throughout this pandemic. Now, address the idea of doing no harm. What is known about harm from masks? Again, medical literature is lacking. I propose some questions that should be asked before we deem masking children as safe without any actual thought or research. Can long-term masking affect speech and speech development in young children? Is masking detrimental to children who already have speech difficulties? What risks are present in children's social development, nonverbal communication, and ability to learn in the presence of masking? Does masking increase the risk of other infectious diseases due to increased hand-to-face contact and soiled masks worn for extended periods? Are children at increased risk of skin infections, acne, allergic reaction, and other dermatologic disorders from masking? What are the long-term effects of population masking on SARS-CoV-2? Is masking facilitating the development of COVID variants? Is masking inhibiting the population's ability to reach herd immunity? Does long-term masking affect children's immune system to any detrimental degree? While these questions haven't been answered, the point of evidence has shown that there is plenty of potential harm that can arise from what we may otherwise say is a benign and safe practice. What we know is safe is letting children go to school without masks because COVID-19 is not a major threat to them. There's no great benefit that can be gained from children masking. There's plenty of potential harm that has not been studied. Let's place the onus of protecting children's health where it belongs with the parents